Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. So hello guys, today I'm going to be discussing about the sickle cell disease in pregnancy. So it's autosomal recessive HBSS. So in a sickle cell trait, which is HB, it's S plus HBA, and it's asymptomatic, right? The trait. So one important point is that in this there's a lot of UTIs and microscopic hematuria. It's a recall. In one MCQ book, I saw it for MRCOG-2. Okay, so these two things are specific for sickle cell trait. Overall, it's asymptomatic, but UTIs and microscopic hematuria happens because why? Because there is relative hypoxia in the renal region, in the juxtamedullary zone. So I think that's why. I don't know the exact reason. If you guys know it, then you can comment below, okay? So this happens with the asymptomatic, the trait type. Now, the patient wants to conceive. She is having sickle cell disease. How will you counsel her? It's very common sense that the first thing is you have to document her intentions regarding conception from the reproductive age. Start asking her what she wants, when she wants to conceive. And then, tell her about three things: vaccination, crisis, and her threshold for seeking medical advice, when to seek medical advice. These three things she should be counseled about. Crisis, how to avoid it. Okay, she has to avoid extreme temperature changes and hypoxia and dehydration. And for vaccination, you should tell her that about, because these patients have relative asplenia because their spleen is shrunken. So all the vaccinations are very important. The Haemophilus influenza B, the meningococcal vaccine, and the pneumococcal vaccine. So I'm going to tell you the schedule. Very important thing is that 3 months before pregnancy, she has to stop the medicine that is hydroxycarbamide. Okay, you need to stop it 3 months before because it's teratogenic. And if she is on this drug and she conceives, then immediately you have to stop it, and you have to perform a level 3 ultrasound for structure. See hydroxycarbamide 3 months before level 3 ultrasound. You don't have to terminate the pregnancy if exposure has occurred, but still you have to look for structure abnormalities. And if she's taking ACE and ARBs, then you have to stop it. And folic acid, she has to take 5 mg, and she has to take it before pregnancy and throughout 5 mg. Three conditions where 5 mg folic acid has to be taken throughout. What are these? These are sickle cell disease, thalassemia, and epilepsy. Okay, so and then what else are you going to talk about? Now we have the end organ evaluation. So this is the preconception counseling. So what is the evaluation we need to do? So very important thing that if a woman has sickle cell disease, her partner status should be known. You should know, right, that whether the partner, because if she is autosomal recessive and partner does not have it, then the child is going to be having a trait. But if she is autosomal recessive and the partner also has it, or the partner is career, then the child might have it. So it will be at risk couple. So partner must be screened before. Okay, and counseling, and you have to identify the at risk couple. Okay, and then for screening we have very important points. Please pay attention. She has to undergo an echo because you have to see for pulmonary hypertension. This is a recall, I think, from Kunje. This question is in Kunje, that specifically pulmonary hypertension. Then you have to also check her BP and her urine analysis for hypertension and proteinuria. Then you also have to do annual LFTs. Every point is an MCQ and RFTs. Okay, every year. And retinal screening. One important question also in Kunje was that retinal screening should be done because of proliferative retinopathy. In which type is it more common? So it is more common as HBSC, the thalassemia sickle cell type. Okay, in HBSC, proliferative retinopathy is very important. So you have to screen everyone yearly for retinal screening, but specifically in HBSC, you have to look for proliferative retinopathy. Okay, so why are you, they ask you, why are you performing echo? So you go like, I don't know, you have to perform echo to look for pulmonary hypertension. Why are you checking BP? Why are you checking urinary protein, annual LFTs, RFTs, and why are you doing retinal screening? and in which subtype of sickle cell you have to be more careful for retinal issue. And then when are you going to look for iron overload? Not in every patient. For example, in thalassemia you have to look for iron overload, in all the patients, because especially if they are receiving transfusions. But in this case you are going to go for multiple transfusions. And if the patient has high ferritin, then in these two cases you are going to screen for iron overload. How? Via the cardiac MRI, okay? Not in everyone. Multiple transfusions and increased serum ferritin, you have to screen for iron overload via cardiac MRI, okay? So this is a very important point. Please remember this, that in all patients you have to screen for for pulmonary hypertension, but you're only going to do cardiac MRI in specific conditions when there are not in all patients. Okay, please remember this every point of screening. It's very important. Okay, then we have the vaccines. Okay, we have since they are hyposplenic, so what are the vaccines? We have the HIV for the influenza, we have the hepatitis B, we have the swine flu. So what are you gonna do? Okay, so the pneumococcal vaccine has to be given every 5 years. Okay, and annually you have to give. This is the preconception time. Still, guys, she has not conceived yet. Okay, annually you are going to give her hepatitis B, influenza, and swine flu vaccine. So which vaccine is given every 5 yearly? Pneumococcal. And yearly hepatitis B, the Haemophilus influenza B, and the swine flu vaccine. Please memorize these vaccines and the time. And penicillin prophylaxis is given, and erythromycin is given if a patient has allergy to penicillin. Okay, so this is very important. Now the patient has conceived. Okay, so one thing, throughout pregnancy she is going to take 5 mg folic acid. Okay, and you are going to do the early scan at 7 to 9 weeks, and the first trimester scan at 11 to 14 weeks, and then the anomaly scan at 20 weeks, right? Now growth scan is done from 24 weeks in three conditions, that is in obesity, in thalassemia, and in sickle cell disease. Growth can start from 24 weeks and every 4 weekly, which means that every monthly. Daily folic acid and prophylactic antibiotics you have to give. Iron supplements only if there is deficiency, otherwise they can be overload. Now very